Hello, everyone. So there was some technical glitch, and now we have Dr. Hadgaonkar with us. Hello, sir.
Hi, good evening. How are you?
Good evening. Good evening to you. So before we get into the conversation,
Yeah.
what do you think about the current scenario of lockdown? Now, slowly, it's opening up, and its impact on overall medical fraternity and surgeries per se.
Yeah, well said, Saurabh, because we all are in a big dilemma right now because we all
True.
feel that this lockdown would have given us a very less number of patients, but on the contrary, it is increasing by the day, and now our number is in top 6 in the world. Mumbai, Pune,
True.
and big cities are still having a large number of patients. So I think this is going to continue for some time. We will have to start working sometime with precautions at this minute because maybe this 15-20 days will be crucial for us, and probably we'll have to go back to what we were doing with all the possible, because patients who are with any other problems like like heart issues or patients with dialysis, they have to go to the hospital. There is no other option for
True.
them even. Yeah, so that is what I feel.
True. And coming to today's topic, so back pain. What is back pain and why does it happen? Let's start from the basics.
Yeah, let's start from the basic. Yeah. So I think back pain is one of the very commonly occurring issue all over the world. Yes, we all know. They always talk about common flu, which was the number one problem in the world. Which, and in recent time it was back pain, which was second to common flu. That is how they were talking about, because each house someone is having neck or back pain because of some or the other
True.
reason. 90 to 95% of the population will have back pain some or the other day. The reasons, I think it's a motion segment. Back, we all know the muscles, we all know the discs, which can get some kind of wear and tear, and we start getting some amount of pain initially with a simple backache, and sometimes muscular sprain, sometimes fatigability because of deficiencies. Various reasons can contribute to back pain. Sitting posture, office, lifting, sitting in the car, driving. Everyone will have some kind of issues when they are doing it constantly for some time. So I think these are the basic reasons. Will be first, I
Right.
will say, is the disc. Second is the muscle. Third can be a facet joint, which can contribute to sprain and back pain. These are the first three
True.
important reasons for back pain.
Okay. So because of the change in lifestyle and overall sedentary lifestyle that people have started to assume, and also the current scenario where people are working from home and their setup is not very ergonomic. So do you think
Correct.
the occurrence of back pain is going to happen more in certain scenarios?
Oh yes, we did a survey, and our student Dr. Ishani also did a survey with Google Forms, for because we were getting a lot of patients with back and neck pain. People
Right.
are staying at home and they're working from home. They used to go to the office, and there used to be some action before. Nowadays, what's happening? They
Right.
are getting up in the morning and they are at home. They're sitting because the office, they're doing the work which they used to do it in the office, but most of them are telling that they are doing more work at home because they're given more responsibilities. So what is happening is
True.
that inactivity is one important reason, as there is no movement of the muscle. Normally, one XYZ, someone goes to the office, he goes down to the car or bus stand or by bike. He goes to the office. There is motion, there is action. Then he sits there, he works there. Then he meets his friends. I mean, all these things are activities are going on in the day. In the evening, you go home and all the things, which is absolutely stopped now. There is nothing. There is no
True.
movement at all. That is the first reason that inactivity is causing a lot of backache in neck pain. Second is we always think about vitamin D, how important, but there a lot of research has shown that vitamin D is definitely one of the contributory factor for fatigue-related pains in the back and neck
Mm,
and
mm,
joints. And
true.
probably in these 2.5, 3 months, anyway, we were deficient with these the vitamins, and probably it is increased, which is leading to fatigability. That is one contributory factor. And third is ergonomic. As you know that how important in physiotherapy that ergonomic is.
True.
And
True.
at home, we are sitting in this sofas, we are sitting in the dining table or on bed doing the work. which is not ergonomically designed. And that's one of the important reasons, because of weird posture we are sitting at home and working, that is contributing to significant amount of pain in the back.
Right.
And we have come up with the paper on that, and we will be soon publishing it.
True. So we'll
Yes.
shortly talk about the management of back pain and backaches in the later part of the life. But what I want to
Yes.
discuss is, so there are a lot of myths around spine surgeries, and we don't really get a
Yes.
chance to speak to a surgeon. So today we've finally got a
Yes.
hold of you. So we're going to bombard you with some myths that are floating
Yeah,
around.
yeah, sure. No problem. That's all right.
So the biggest myth that is around, and I've been hearing this since ages, that spine surgeons will always recommend surgery.
I know. That is a very commonly talked subject, and
True, true.
I don't think so. It is, it's like you go to a cardiologist and he will do stenting or bypass surgery. It's not like that. I will say
True.
around 90 to 95% of the patients really don't need surgery. And
Right,
we
right,
also do not recommend surgery. The myth is busted. Definitely,
right,
most of them don't need surgery. What they need is a good, appropriate exercise protocol, a good physiotherapy, and that is where your role comes in. Most
right,
important
right,
prehab and rehab. Also, there is a huge amount of population which is having back or neck issues or joint issues, and they are not basically surgical patients. If you assess
right,
them well, then we will realize that most of them can get better, and therefore there are a lot of people who are treating back, and we see people are going for some ayurvedic massage or things like that, and probably they are also getting better because there is a natural
right.
history of getting better for this disc and stenosis. So I do,
True, true.
I completely disagree that spine surgeons offer only surgery. We always offer appropriate management, and most of the time it is non-surgical.
True. Very, very correctly put. There is also a lot of phobia around spine surgeries. So people also think all spine surgeries are major surgeries.
Correct.
How much truth is there to it?
No, I think that is true. Spine surgery is comparatively a major surgery. Yes, we do agree. But with the advent of technology, the techniques, things have become much, much easier and better. If you
Right,
just see the history of technology and advancement, in the 80s, we were not having any CT scans, and we started getting CT scans in India. Before that, always was the X-ray and myelograms, which we have done. And in the
right,
90s, we started getting the MRI scans. Before that, if you just imagine, most of the doctors, the seniors, they have done with the clinical examination and with the X-ray and myelogram, they have done the surgery. So that's a very challenging scenario. Even brain surgeries were done like that because there was no development in that time. And
true,
now, if you see, we have all the possible investigations. It becomes very easy. We can do minimal invasive, small access, minimal access, all these things. Specific targeted surgeries. Therefore, spine surgery is not anymore a very risky surgery in most of the cases. 70 to 80% of spine surgeries are reasonably standard operations. Yes, there is an element of fear factor in few of them, like we see the spinal cord injury, we see the spinal tumors, severe compressions, neurological deficit. Yes, there is, because surgery can be, you can do the surgery, you can decompress, stabilize, but recovery and outcomes is not in our hand. And then we
right.
have to again fall back on the time and the good rehabilitation, good physiotherapy, and all these things. And each case is different, but in general, if you see, most of the people will have low backs or neck aches. These surgeries are reasonably standard surgeries, I would say.
Right, and the risk involved in them is not as much.
Not as much. People think
True,
that
true.
you will have a neurological deficit like that. Not in very fewer percent. I will say less than 5% of the surgeries can have possibility and probability of having neurological
True.
issues.
And like you rightly said, the advancement in technology and diagnostic tools have been as such. Earlier, the recovery used to take a little longer. But nowadays, I don't think so. That's a thing. So there is another myth around spine surgery is that once you get a spine surgery done, you will never be normal again. How true is that?
Yeah, yeah, that is true. People, and how it is changed. It is all evidence practice, and in the past, if you see, because of various things, people were operated and they were given long-term rest. Things have changed. I will say they are not wrong. What they did was also a very right thing, because every time there are a lot of
True.
things and research, and things are changing a little, but not anymore. Most of the patients will not need to be in bed. They can go back to what they were doing in 3 to 4 months time, in 90 to 95% of the times, unless the condition of the patient when he is presenting to us is really bad, or he is already worsened with neurology or bordering impending on neurological deficit. Those cases may take a longer time, or someone with a spinal cord injury, if you see, that's not in anyone's hand, and where the
True.
recovery
True.
can be really a long drawn, and he can really take a longer time, but not in most of the situations. I would say no. 90%
Okay.
of the patients will go back to what they want to do. We have some cricketers, we have some players who have gone back to their national level and international level sports event after the spinal interventions.
True. Understood. Another myth around spine surgery is after spine surgery, recovery is very painful, and painkillers is something which is going to be part of your routine for lifetime.
Yeah, I mean, I think you really studied it well, Saurabh.
Yeah.
You're asking all the questions which someone is keeping it in their mind.
True.
And I will say yes, painkillers maybe for a shorter time, but most of the time, maybe for 4 weeks, 6 weeks, patients need the pain medications on and off. But I will say maybe 5% of them probably will require it long term. But I
Right.
completely do not agree with the fact that you need painkillers for a very long time. Sometimes back pain may take a longer time to recover, because back pain is something we have to do good rehab, strengthen abdominal, core muscles, back muscles. It's not only surgery. Surgery will give immediate relief. Low back surgery will give immediate relief for your leg symptoms primarily, and that's the reason it may sometimes be patient will feel that I'm taking painkillers still, even after my surgery.
Right. Right. So there is another myth. Ki after a spine surgery, you will have to be bedridden and you won't be able to walk for at least 3 to 4 weeks. Now, I want to ask this question in two parts. Ki is it true? And if it is, like, why people have this mindset?
Yeah, means what you're asking is absolutely a very, very relevant and a very good question, Saurav. I think if you see the evolvement of orthopedic, joint, or spine surgery in the olden days, for fractures, people used to be in bed with the cast for a longer time. But nowadays, the trauma surgery also has changed significantly, where they are operating, and these patients can be early mobilized for various reasons. Patients for in bed or for a longer time. Normally, in lower backs, the patients are mobilized the same day or the next day in most of the scenarios. Yeah. So
Right.
it's
So
absolutely
from
again the yeah,
so
we
from
don't
what I
we don't
understand,
agree with yeah.
right. So from what I understand till
Yes, yes.
now is ki whatever myths or whatever concepts people have about spine surgeries are basically
Yeah.
a decade and a half older, and maybe there is not
Maybe
enough
two,
awareness
three
around
to
it.
four decades older, 3 to 4 decades
Wow.
older.
Wow.
Maybe in the
Right.
80s and 70s, not
Right.
anymore, because from last, I can say from the 21st century, significant changes have, they have occurred in these treatment protocols, and technology is also supporting us in a big time. And the
True. True.
PET scans for tumors and things like that have really helped us in big time. Even if you see in physiotherapy, we have, when I was in England in Newcastle Deanery, we used to have a beautiful gait analysis lab. It was like a huge,
Right.
like a complex, and they used to assess the patient for gait and pre-operative, post. So it is significantly changed. Therefore, the outcomes we are getting is definitely better, I would say.
True. Technology is basically improving every field, and from medical fraternity, I guess it
Yes,
has done
yes,
wonders. True.
absolutely, absolutely.
Perfect. There is also another misconception, or you tell me if it is a misconception, that after spine surgery, knee pain and lower limb problems will also get solved.
Oh my goodness, this is a really this is what a lot of patients. Doctor, will my knee pain go? Mother gudga dukhi zail
Yeah,
ka? That's a
barabar.
very very important question because they feel well, they coexist in a lot of patients. Knee and low back because they're weight bearing joints, knee as well as low back. So when you get up, you have a lot of stress on the knee. When you are sitting, you have a lot of stress on the low back. And this coexists. A lot of time we have to balance whether we should consider the knee surgery first or spine. In situations where there is a significant compression, then we prefer that we should do the spine surgery first. But we can't promise the patient because if there is a tricompartmental arthritis, then we will have to tell that yeah we are doing a specific segment surgery. Sometimes they
Right.
can get better with the cramping pain which is there in the calves, but we can't promise them about the knee pain for sure.
True. Understood. Now coming to the physiotherapy part of it, like so there is a lot of dilemma around using orthotics, like LS belt for that matter. So we want to have your perspective on that. Is LS belt mandatory for every surgery or for
No,
every back pain?
I would like to, yeah. It, absolutely, Saurav. I think you really studied very, very apt questions, and you really
Thank
want
you.
to burst the myths. That's what I can
Yes.
say. If you see the data is mainly from the Western world. Data is not mainly from coming from our side or Indian side. And in the Western world, they have reduced the use of low back belts or cervical belts. And if I see in my practice, a lot of patients who come to my clinic, they are wearing the belt in the neck or they are wearing the lower back belt. I will say कि probably evidence is going down and down. It is getting lesser and lesser. But cervical spine, as it's only the head, like Atlas holding the globe. Cervical
True.
spine,
True.
the neck belt definitely works in general. But lower back, whole body weight is probably not getting good support from the lumbar belt. So the role and rationale for lower back belt is comparatively less. But one thing I can say in Indian mindset, when the patients are wearing the low back belt, they automatically restrict their activity. Sometimes the low back
True.
belt can
True.
give the warmth, vasodilation because of the back. The belt is tightly tightened in the low back, and they feel better. The feel good factor is also quite
True.
a lot. If I tell the patient that why you are wearing this belt, the patient will tell me that doctor, I feel better when I use this belt. Then there is no
Right.
answer because whatever is giving you relief, you should use that. And but in general, I personally don't prescribe much of a lumbar belt. If at all
Right.
cervical for disc, yes, I can. Yeah,
Okay, understood. Now, another thing. Now, this
yeah.
myth is very close to my heart being a physiotherapist because we have so many patients walking into the clinic when they have pain and directly asking us, Ki, I want to take traction. What are your views about
Oh
lumbar
yes,
traction?
yes. No, no, correct. It's really biased. If you see literature talks on both the side, literature talks with supporting the traction, literature talks against the traction. In general, if you ask
Right,
a surgeon, they will say, no, no, I have reduced or I'm almost not using the lumbar traction in my practice. But if you
right,
practically realize that patients are happy when they are given the traction, they feel, because if you see the natural history, 90%, 95% patients are going to get better because
right.
the compression is not
True.
severe, instability is not that bad, and there is a bounce back, and they will come back to. So in those patients, you give them traction, you give them other modalities, they probably will feel better. But in when they did prospective studies for this, both of they were not very much satisfied with the role of long-term traction, but probably intermittent traction is having some role for relieving the spasm at that time and giving some kind of relief. But if I see my lot of orthopedic colleagues, they still use traction and they are very happy with the role of traction in their practice. So I will
Right.
really not be I will not be able to answer exactly because everyone's practice is different. I
True.
personally prefer to avoid lumbar traction, but cervical traction I definitely use in my practice.
Understood.
That's what I can talk about. Yeah,
And it boils down to if patient is feeling better
comparatively
from
less.
that or not.
Yeah,
Right.
yeah, 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 yeah.
While we are on the topic of physiotherapy, that's all the myths that I had to ask. Now I want to ask about a little bit of management part of it.
Right.
How long and when physiotherapy should be done in terms of spine surgery?
Okay. I think nowadays we are encouraging and talking a lot about the prehab as well as the rehab, not only the post-operative, but the pre-operative as well. And I
Right.
personally definitely believe a lot on physiotherapy because I have significant outcomes, and I'm very specific about asking some good physiotherapist who is doing the right protocols, and I'm very specific about sending my patients to those who are giving a very good outcome. And luckily, we have
Right.
very well trained physiotherapists in our institute. Therefore, the question of choosing the physiotherapist does not come. But in
Right.
general, we start the physiotherapy on the day of surgery.
Right.
The day patients are operated, in bed exercises and breathing exercises for a cervical spine starts the same day, but we go very gradually because nowadays we have started doing 100 minutes mobilization for lumbar spine surgery, where the physiotherapist will come. They will assess the patient's general condition, and normally their patients in the lower back surgeries are mobilized the same day. Therefore,
Right.
we really don't want to the patient to be in bed, because there are various advantages of early. Be careful in
True.
fewer situations. We have to wait, and we have no option. In that, those are like 2 to 3% of the cases. But most of the times, yes, we mobilize the patient early, and we are very strict about at least 4 weeks rehab or physiotherapy for patients of spine surgery. And we believe that because okay, it is just like going to the gym or someone who is having a trainer. So the person who is having
Right.
a trainer and doing the exercise makes a big difference, because someone is definitely looking at you, how you are doing, what you're doing, things like that. Just telling them do exercise, yes, you can tell that, okay, there is no hard and fast rule that there is only physiotherapist should see. But if the physiotherapist is there, they can really assess the muscles, they really can assess the strength in the limbs, and accordingly they can plan the patient's. And this is required only in the initial 4 to 6 weeks time in most of the cases. Very fewer times
Right.
where there is a major reconstruction, things like that, deformities or tumors with weakness, where we need a longer term rehab. But otherwise, post-operative patients, I will say 4 to 6 weeks, and once the patients start doing activity, they can go back on normal exercises as per the advice from the physiotherapist.
Understood. I guess it's a very welcome change to overall rehabilitation that early mobilization is now encouraged all through the spectrum of surgeries. But I would like to bring your
Yeah.
attention to prehab a bit more because it's comparatively a newer concept in India, and now it's we started doing that. But I would like you to enlighten people more about what prehab is in spine surgeries.
Yeah. No, it is like, okay, there are when we are doing elective surgeries, this is a very unique model where you explain, because at times when you talk to the patient after surgery, they are sometimes in pain, they are mentally not prepared to do the physiotherapy, and prehab is something which will help to boost them. You tell them, you talk to them, you explain them in advance. It is simple as that, keep preparing their mind for the exercises and teaching them those exercises. This is definitely of a big help, because then they automatically, the minute they see the physiotherapist, they will say, oh, chalo, doctor, let's start doing the exercises. We don't need to
True, true.
explain, and there is a big role. You can talk to them about extension, flexion, whichever exercises you plan for them. You understand the surgery, and you plan breathing, whatever exercises you really want to start, extremities and core strengthening. All these things really can make wonders, and basically patients will
Understood.
go back to their own activities of daily living very quickly if we start doing
Right.
prehab for most of the patients. Yeah.
True. I guess the
in
way
in
this whole
yeah
life has been. going on, I guess this is going to be a good reference material to convince patient and clear their confusions. I guess we should just show this video to patients so that their misconceptions are cleared about a lot of things.
Absolutely. 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 I agree. I completely agree.
While we are on the topic of recovery, do you think after spine surgery, is it the complete recovery to get back to a competitive sport is possible?
Yes, yes, I definitely see that it is possible to come back to competitive sport unless you have some major element. And in 95 to 98% of the time, you can go back to competitive because most of the youngsters have a very good ability to fight for their rehab and get the strength and muscle back, all these things in most of the spine elements. What normally we see in youngsters, we see a disc in the lower back, we see a disc in the neck, we see a lysis. I have treated a couple of athletes and gymnasts and swimmers for spondylolysis. And
Right.
there is subtle or no spondylolisthesis, and they are really worried. Some even Maharashtra's Keshris, the Kusti and Kabaddi players also we treat. They also have disc and lysis issues, spondylolysis. They are recoverable, but we need to explain them. It may take some time. 2 to 3 months is the average time for them to bounce back. But yes, they
Right.
definitely can go back to what they want to do in their respective sports field. For sure, yeah.
Okay. Perfect. We are almost at the end of the live. So before I move to my next question, I would like to urge our viewers, in case you have any questions which you would like to ask Dr. Hadgaonkar, please put those questions in the comments. So we will not let him go that easily, and we'll ask all the questions that we want to ask. So for the final question, you being you very physically active in terms of sports, activities, and exercises. You do cycling. You are a triathlon
Yes.
player. You do marathons. So what is the importance of having physical exercises and physical activities part of your daily routine?
No, I think I believe in something called as meditation. As I was a state level table tennis player. I played cricket at a high levels when I was in the school time. I always feel this is something is like a meditation. If you follow some passion and giving. I personally do. I like running. I like walking. I like cycling. I like swimming. And now these are the sports where it is not just a sport, but it is giving you something like a healthy feeling.
True.
A sound body and a sound mind, what we normally talk about. When you are yourself, you feel better. Your perspective is different. You're cheerful. You're doing activities, and at least religious regular activities are important for each individual to focus in their careers, even if it is student, even if it is a professional, physiotherapist, doctor, healthcare workers, for everyone, I think this is very, very important. And if you start and then it's like a learning, you go to next stage and you start learning more, and then you go into the depth of it. And now we have a very good cycling group, we have a very good runners group, and then you connect with a lot of people. That also is a
True.
big advantage. And they say I go on mountain to see the world, not to show the world. You really
True.
enjoy those moments, and it is also de-stressing. It is not only you are doing cycling, but it is very, very de-stressing. If you're running, you automatically feel, you're doing something, you feel energetic. And I think that is the way to keep yourself fit.
That was a
Someone
perfect
likes
way
to
to
go to the
put it.
gym. Yes, even yeah, someone likes to go to the gym. Strict criteria that one should do this only, or someone can use a static cycle at home. If they are really busy, they can do the cycling at home 30 minutes, and it's good enough.
Right. Right. True. Uh, I guess that was a very perfect way of putting it, including some kind of physical.
Yes, Saurabh.
Yes.
Some net
So I
issue,
guess
I
we
think,
can
from your
move to
side.
audience.
No, I think Am I audible? Am I audible?
There was
Yeah.
some network issue that we were
Yeah.
experiencing.
Yeah. Yeah.
So we are getting a few questions. So I'll just go
Yes.
through the question and ask you a few relevant
Yes. Yes.
questions.
Please. Yes. Of course. Yes.
So we have a question from Raven. Can I go for pain block injection or physiotherapy? It's a
Oh,
either or question.
yeah, that's again a very good question, because we always talk about disc or some issue in the cervical or lower back, and someone is not getting better with exercises, physiotherapy, and constant pain. MRI and X-ray, everything is showing that there is a problem. In these situations, yes, pain block is a safer option if you do it with a trained person. You can do it with a spine surgeon. You can do it with some pain specialists nowadays we have. They also can do, and I will say 60 to 80% patients can get relieved for a shorter to moderate duration of time. And in that time, we should focus on doing good rehab and get back to life. That is a very good via media, and we are doing it for almost 15 years now, and it is done worldwide. So pain block is one of the very good via media nowadays, which can be tried in selective patients.
In
And it's a day
continuation to that,
procedure.
we have
4 hours you go home.
right. Okay. Into continuation to that, we have another question. This question is from Hetal. How does the pain block help to prevent surgery, or does it help to prevent surgery?
Yeah, Hital, good question. Most important, I would like to talk is that if the problem is very severe or the disc is very large, then probably pain block may or may not help. But in moderate situations, foraminal compressions, what happens in acute phase when the disc is out, physiotherapy is not helping, medicines are not helping, it helps to relieve the inflammation, the interleukins, the prostaglandins, which are released in the canal after the disc, which is erupted out, and it helps to reduce these mediators of pain. The minute it is blocked, the patient starts feeling better. Oh, I'm feeling better, and that betterment continues to give them more betterment. And our
Right.
experience, around 70 to 75% of patients of pain block really feel better and get better.
Okay. All right. We have another question from Deep. What precautions to be taken after post-operative, mainly after 12 weeks? So 12 weeks post-op, what precautions should be taken?
12 weeks, and okay, it is a very diverse, important question that at 3 months, what all things we should allow.
True.
One is that if the patient is with any stabilization, fixation is been done or no, that's one thing. If the patient is with long segment fixation or short, and if the patient is with only decompression, in lower back I'm talking about. If the patient is with mainly only decompression, discectomy or things like that, yes, they most of them can really do most of the activities, walking, doing activity, playing, things like that. Fusion at 3 months, if the patient is younger patient and where they are showing very good pain relief at 2 to 3 months, they also can really go back to what they were doing. Someone with osteoporotic age and bones are very weak and multi-level fixation, we have to be a little slower in those individuals, because sometimes because osteoporotic medicines we start along with the post-operative protocol, but it takes time for the bones to heal well, because bones are weak that time, and that is the reason maybe we have to assess it at that time, and maybe a couple of months more for doing most of the activities in a longer
Right.
segment elderly patient.
Yeah,
Otherwise,
I
at
guess
3 to 4 months,
that
most of the low back should do activities. Yeah.
I hope Deep that has answered your question. We have another question. Uh, is it necessary to visit a doctor regularly even after 5 years of surgery?
No, no. I think it's not necessary to meet the doctor after 5 years or 3 to 4 years, unless the doctor wants. Like in children, where
Right.
we are doing scoliosis, we do deformity surgery, where we need a longer follow-up, or we are doing some tumor surgeries, where we are expecting some kind of giant cell tumor, where there is a possibility of a recurrence. then these patients, yes, we need to monitor, we need to do the investigations at time. But otherwise, in 90 to 95% of the patients, we don't need a regular follow-up for that long. Our protocol is around 3 months, 6 months, 9 months, and 1 year in most of the patients, and one at 2 years. Because then it is good for outcome scorings. We know how it is they are doing at 24 months, and patients are also happy at the end of it, and they also don't want to unnecessarily go to the doctor. So I personally do not recommend 5 year for sure
Right.
in most of the
Perfect.
patients.
We have a question from Ganesh. Hello, Dr. Shailesh. Can chronic sciatica be reversed through a strict regime of appropriate and adequate daily exercises and ideal sitting posture?
I think yes, sciatica can be reversed, because sciatica we have to understand why it is happening. Is it happening because of a large disc or any other reason? If it is, most of
Right.
the time it is a disc, and if the disc settles, sciatica will settle. So I think modification, ergonomic, proper anti-inflammatory, proper rehab, physiotherapy exercises will definitely help to go back on sciatica and pain in the legs or radiating pain for sure in most of the
Right.
instances.
We have a question from Neha. In chronic pain cases, what is the success of surgical procedures? Does it help with the central sensitization component?
Good question. I think in chronic pain, I would say success rate is around 80 to 85%. 15% patients may complain for a longer time of this pain element, because it will not immediately go. Okay, muscles, everything. Okay, we are not replacing like knee replacement or any other surgery. We are not doing replacement surgery here, or bypass where we are taking out the leg vessel and replacing it here. In spine, we are doing a decompressive surgery. So we are keeping most of the normal element, neural element as it is. We are just refashioning by decompressing, stabilizing them. In that context, I will say 15 to 20% patients probably will continue to complain of some amount of aches and pains.
Right. Okay. I hope, Neha, that answers your question. We have a question from Gauri. Sir, as you are one of the few who do deformity corrections in our country, so can you put some light on it? I guess she wants to know like deformity corrections and things around it. Like,
Rehab post scoliosis surgery. That is what Dr. Gaurish is asking, right?
yes.
Uh, yes. Hello, Dr. Gaurish. Yeah, he's one of the eminent physiotherapists from Mumbai, and we see his programs also for rehab. In scoliosis, our protocols are very specific, because first is that we need to identify which type of surgery we are offering. Or Scoli-Schroth exercises normally we talk about before the surgery, we monitor the patient, things like that. But post surgery, we have to be very specific. There are two type of surgeries in scoliosis. One is that a surgery with short segment, like in hemivertebra, where we are doing a shorter segment fixation, and the other surgery is a longer segment, where we are talking about neuromuscular, neurofibromatosis, congenital scoliosis, or idiopathic adolescent scoliosis, where we are doing a longer construct. In those patients, Dr. Gaurish, we always are very specific. At least 2 or 3 times in the initial 15 days is mandatory from our side. In this spirometry and chest is very important from in our unit, and we talk about have neck and back rehab, core strengthening, quadriceps, hamstring. So in this, it's a complete rehabilitation when we talk about scoliosis or deformity surgery. And the people who are treating scoliosis, they have to be specialized, giving time, because that is important. And getting up, recovery phase is very slow in some patients. Some of them are very active. So these things we have to balance, and it's case based, but I think giving good time and understanding what was done is important in scoliosis rehabilitation.
Perfect. Uh, I guess, Nikita, this has answered your question as well about rehab post scoliosis deformity correction.
Yeah, and I always believe that physiotherapists play a very, very big role because they are the people who are connected to the patient mentally, physically. Yeah, they are holding the
True.
hand of the patient and they're making them stand. They are the people who are talking to them, morning and evening 2 times or 3 times. So their connect is more stronger than surgeon at times, I feel. So therefore, it's a very, very important role. And the way they reassure the patient, no, you'll be fine. We are doing this. You have some weakness, it is so important. And I always talk about very high about physiotherapists who are dedicating themselves and they are getting fantastic results. Those who are
True.
well trained and they are connected to the patient. The best quality of a physiotherapy is connecting to the patient, and no one can stop these kind of physiotherapists in their private practice for sure, or whichever academic or private practice.
Right. I totally agree. And we have one more question. Let's take that. If the pain subsides after, if pain subsides after taking the pain block injection, then it remains closed. Like the basically effects of pain block stay for how long? That's what Raven wants to know.
Yeah, it's a very good question. It's normally we don't tell the patient that it will be for a very longer time, like year or 2 years. But few of the patients really feel better for a very long time. But normally 3 to 6 months is a good time for patients to get a good relief, and that is a time where they should do a good rehab and get back to what they want to do. Because the conditions are moderate, they are not very severe, where there's a good chance of getting
Right,
better
right.
if they strengthen themselves well.
So I guess people, rather than looking at pain block as a solution, they should look at it as a golden period that you've got to get your back fixed with exercises and with a good rehab protocol.
Absolutely, absolutely. You said it, Saurav. You said it. They should take it as an advantage to get
True.
better. And we do recommend in few of the patients, we do recommend the pain block one more time. 7% recommend
Right.
block once again because there are patients with lot of comorbidities. We don't want to operate them. We want to rely more on or very elderly, and a lot of patients are very not very keen for any surgical but intervention, but they are suffering. In these situations, we offer them blocks for sure. And youngsters with,
Understood.
of course, disc disease, block really works well.
Right, right. All right, so I guess I'm afraid that's all the time we have. I'm sure that people would like us to keep on going with this. They have a lot of more questions, but for that, we can do another live another day with some different topic. And
Yeah,
thank
I
you
just
so
would
much,
like to
Dr.
tell one
Hadgaonkar.
story.
Yes,
I
please,
just
please.
would like to tell one story, Saurabh.
Yes.
There was a lady, there was a patient, uh, Mary something, and this is 2009-10 when I was planning to come back to India from England. And very interesting story. It was winter and it was snowy winter in England. And this lady came to the clinic, spine clinic, and she was talking about back pain. And somehow she came to me. And it's just like it's a small county, and there are different patients like John Wright. There are so many John Wrights in one county. There are very few names. There, अपना जैसा नहीं है कि एक name. We saw, I saw, and then that lady was date of birth was 1908, and she was complaining of back pain, sprain, and I examined her. There was localized tenderness. It was snowy. It was very cold weather, and no radiation, nothing. I said, okay, this is quite a senior lady, 102. I can give some anti-inflammatory, and I gave her some hot fermentation, things like that. And I told her to come back after a week because she appeared to be in a rush to go back. And I said, okay, no problem, because she came alone. And after 1 week, 10 days, she came back to the clinic, and I asked her, Mary, how are you doing? And she said, Doctor, I'm doing really fine. And now I was amazed because I was remembering when again I saw her file. Her date of birth was 1908. She was 102. And I was more curious to ask how she's come alone, not with any relative, how she's managed to do so many things. And then I asked her, how did you manage to come here? You look, she said, Doc, I came driving my car. And I was amazed at 102 someone can drive their own car. And I was just thinking about India, about my relatives, and they feel at 57, 58 we are retiring now, and now abhi retirement ka time aa gaya, abhi kuch nahi karne ka hai, things like that.
True,
And
true.
she was 102 and she was doing everything. I thought, how come she has managed to keep herself so fit? She was walking alone without any stick or any support, absolutely normal. She came to tell me, should I go for physiotherapy because I'm feeling better? I said, yes, you can go and learn the exercises and do it at home. And then I asked, how did you manage to keep yourself so fit, Mary? And she told me, Doctor, I was an athlete when I was young. She was a gymnast in probably the Second World War time or First World War time. And because she was born in 1908, and she was from the national squad of England. She was never there in Olympics. Somehow she missed it, and that was the reason that she was very fit. And then later on, she used to run for so many years. She told me around 75, 78 years, she used to run regularly for marathons or local area runs. And then she started continue to walk, and she used to walk for any work, anything, because you have to do your own work. She used to buy things for herself. She used to walk for everything she was doing on her own. And probably that is given her the strength to be fit on her own feet. Walking was the thing which I realized, walking or something like this activity is so important to keep yourself so fit. And that was a
True,
big
true.
message which I realized how important is simple life, but you keep yourself fit by doing some kind of these kind of activities. And that's the message where
That is
your role comes
that
as
I
a very,
totally
very
agree to
strategic and
that.
important role.
True. See, like we simply like day-to-day activities, simple.
Saurabh side. Yes, Saurabh, hi.
Yes, I saw. Yeah.
Some
So I was
issue, I
saying
think.
that was a perfect way to sum up this session, mentioning the importance of day-to-day activities and keeping yourself fit and healthy.
Yeah, absolutely.
I would like to thank you so much for such a wonderful session. You've explained and busted most common myths around spine surgeries. I guess this live is going to be helpful for a lot of patients who are suffering from back pain. Uh,
Yeah, hi, Saurabh. Yeah.
yeah, yeah. So this is going to surely help a lot of people who are in dilemma of getting a spine surgery.
Work, and of course Sancheti Hospital for giving us the opportunity for this interactive live session. This was my first of its this time type like Instagram live, and
True,
really
true.
thankful to you, Saurabh, for getting across a very interactive session.
And we would love to do another session with you and on some more interesting topics.
Yes,
And we always get recommendations from people what they would like to hear. So I request all our audiences do send us a direct message and tell us what you would like to hear from Dr.
yes,
Shailesh
yes, yes.
Hadgaonkar. And we would request him to come again on live and do another session with us. Thank you so
Perfect.
much, Dr. Shailesh.
Thank you very much, all of you. Thank you. Bye.
Bye.